Bullying is hate.
Bullying is destructive.
Bullying is mean.
Bullying is inhumane and cruel.
Bullying is for people who are insecure about themselves.
Bullying is hurtful.
Bullying is intentionally causing hurt to someone either physically or emotionally.
Bullying to me is intentionally hurting another person.
Bullying is when someone is going after another person.
Bullying is to seek someone out to harm them in any way.
Bullying is making others feel small so that you can feel big.
Bullying is putting someone else down in order to feel better about yourself and give yourself a sense of power.
Bullying is one person saying or doing something to bring another person down.
What is bullying? Bullying is defined by the APA as a form of aggressive behavior in which someone intentionally and repeatedly causes injury or discomfort to another person. We think that this definition is a bit narrow. We think it has more to do with the perception that somebody has to our words or actions. We may not be trying to be a bully, but someone else could perceive us that way. Anybody could be a bully, and bullying happens everywhere.
Some telltale signs of workplace bullying include the workplace undermining someone who is just trying to do their job, demeaning confrontation between workers in front of other staff, and the victim feeling nervous to go to work in fear of being told they are incompetent. Consequences of workplace bullying include the victim feeling anxious and depressed. Psychosomatic symptoms may also occur, including headaches, eating disorders, and post-traumatic stress disorder. Bullying can also impact healthcare organizations. It can cause work dissatisfaction rates to increase, lost productivity, and an increased rate of work-related injuries.
One thing that I have seen is there can be physician to nurse bullying, or patient to nurse bullying, or even nurse to nursing student bullying. I can think of time where physicians have kind of gone out of their way to be not as nice or make me feel like the questions that I'm asking or the information that I'm relaying is irrelevant or unimportant. It's not the best feeling, especially as a nurse. Your patient comes first and you're always concerned about doing whatever you can to make sure that their needs are being met. And one of those responsibilities includes direct communication with the physician frequently. So I've had times where physicians have kind of made me feel like what I'm concerned about is unimportant. And in those situations, it's just important that you handle it in a way where you express that you are looking out for the patient's best interests and that you appreciate the response, even if it's something that kind of you weren't expecting. As far as patient to nurse bullying, I feel like I see it where boundaries get crossed. I think when you have a patient who's kind of pushing boundaries a little bit, maybe not speaking in such a respectful manner or acting in an unrespectful manner, it's important to set your expectations with each other. You're there to build a trusting relationship, and that's hard to do if one party is disrespecting the other. In those situations, I just set boundaries. I say, I'm here to help you. What I'm doing and what I'm saying is to help better you and help get you home. It's hard for me to do my job as well as I can to help you when you speak to me that way. Or I would prefer if you spoke to me in a better, a nicer tone or a softer tone, or it makes me feel uncomfortable when you do this. And if you feel like it's not a matter that you can't address on your own with your patient, it's important to go to another nurse, ask their opinion, go to your charge nurse, go to your supervisor, your manager, and have someone else step in if you don't feel like you can handle it on your own.
So how do we deal with bullying from a caring perspective? From the beginning of class, we have talked about the power of words. As a nurse, try not to take things personally, even though it may feel personal. This is an opportunity to ask what happened to this person rather than why am I being picked on. This can also go for your patients. The way in which we speak to patients can be misinterpreted. While we want to ensure that our patient is cared for properly, the way in which we speak to them can make them feel like they are being bullied. It is important to remember the reasons as to why you became a nurse in order to keep a positive outlook and to stay self-aware of your physical and mental health. One main way to combat bullying is by talking. Communication can make all the difference.
What is caring?
Caring for your patients is to always be there for them unconditionally. No matter what is going on in my day, I'm going to walk through the door and take my assignment and be there for my patients. Whether I have 4 patients or 24 patients, I am going to give them unconditional care. I'm not going to be irritated with them or irritated with my coworkers or irritated with the workload or take away from being nothing but 100% there for my patients, giving them whatever it is that they need in the moment that they need it. Caring is something that comes from within. I have it inside my heart, and some days I feel very drained after being at work all day and giving and giving and giving and giving and not really getting anything back except for patients needing more giving. And I do feel drained at the end of my shifts, some days more than others, but I can honestly tell you that that draining feeling means I gave it my all. I genuinely care for my patients no matter what the circumstance, and even if some bad circumstances entail over my shift between myself and my patient, I always make sure to follow up with them and leave on a good note.
One of our responsibilities as nurses is to create a caring environment for our patients. This could possibly be one of the worst days of their lives. They don't need added negativity due to bullying in the environment that they're trying to heal in. The negativity related with bullying can be diffused into caring by changing your perspective on the bully. Ask yourself where their intentions are coming from. It may be a deeper problem than just their relationship with you. Communication is important to make sure you understand your bully, why they're doing what they're doing. Studies show about 57% of bullying cases stop after intervention. So just do something about it. It's important to radiate positivity regardless of how another person makes you feel, and never let negativity or hostility affect the way you care for your patients. People depend on you.
Caring is thoughtful.
Caring is love. Caring is constructive.
Caring is compassionate, good-hearted, sympathetic, and thoughtful.
Caring is for people with kind hearts who treat others the way they want to be treated.
Caring is considering another person's needs and doing your best to accommodate those needs.
Caring is to be kind and thoughtful.
Caring is showing kindness and concern for one another.
Caring is giving effort to someone or something that is important to you.
Caring is compassionate.
Caring is reaching out to others and showing them that you're a friend.
Caring is being sympathetic towards another person as they experience that pain in their life.
Caring is having someone else's best interest at heart.